Acting Medical Director Dr. Tyhiesia Donald is appealing to the general public to stop making prank calls to emergency departments.
I can confirm that we have had these prank calls, and it's actually very sad that this is happening in the midst of the pandemic with a number of cases that we have and persons seeking medical care. So I would really like to ask the public to work with us. Please work with us. Think of it like this. Now, if you do a prank call and there's someone, a family member, who actually needs to have that ambulance call, what would have happened is that the resources would have been deployed to an area that is not needed for an area that is actually in dire need of that service. So it means that what would happen is someone who needs urgent care would be deprived of that care because of your prank call.
Dr. Donald, speaking during Wednesday's post-cabinet briefing, said the practice is affecting the system.
I mean, we've had instances where an ambulance would go to a household and the persons there don't have any idea why the ambulance is there. And then you have the other instances where ambulances go out and then no one is there. So we have the two scenarios. No one is there, and the other scenario where the persons within the household have no idea why the ambulance is there. So I really want to ask persons that we should really stop that practice, because it's affecting our system, and it's actually deploying a service to an area it's not needed. And persons who really need that service will not get the benefit of it.
Meanwhile, the acting medical director is appealing for patience among the population, as increased COVID cases are having a negative impact on staff at health facilities. She said that a number of healthcare practitioners have become ill.
So what has had to happen is that we had to crunch. So whereas persons who would have been scheduled for surgeries and so, we had to now put it off and divert to just urgent cases, urgent and emergency cases. So all the elective cases, meaning cases that are scheduled and it does not having the surgery today or tomorrow does not affect the person's well-being, we had to put these cases off, right? So, and then of course it means that this person, whatever problem they're having, they have to bear with it for a little longer. And then in terms of, for example, places like the accident and emergency and our outpatient clinic, it's become very challenging because, of course, the wait time sometimes to access care is longer.
Dr. Donald said these challenges are affecting services at both the community healthcare centers and the hospital levels.